most of the day, and at night I would go to bed at 8 o'clock and get up at 8 o'clock the next morning and of course go right back to bed again. This impacted my family negatively as well. I have 2 children. This was about 3 years ago when this hit. My kids now are 11 and 9, and they felt cheated. They didn't have a mom, and I wasn't able to get up and make them breakfast in the morning. I wasn't able to take them to the store and buy them clothes or make them a nice meal. And my husband took over, and he really was tremendous through the whole thing. Chronic fatigue syndrome and Epstein-Barr, because they're not a medically well-defined disease, people just don't give it the same sort of appreciation that they might if somebody had cancer or if somebody, you know, had 2 broken legs. And so it was very difficult for them. After I was diagnosed with the Epstein-Barr virus, the doctor told me that there was no cure for it. And there were times when I was very depressed because there really was no end in sight for me. I've always been a very high energy level person, so when this hit, it became a very devastating thing, but I was not going to allow it to take over, and I didn't. I pursued what I now refer to as a portfolio approach to cause and to treatment, and by that I mean that I tried many different things all at once. I was doing only organic foods. I was doing only vegetables, green leafy vegetables and other types of vegetables. I was doing osmosis water. I was purifying everything I was consuming. I also used magnets, and then eventually I also came into the Beck protocol. A friend of my mother's had used the Beck protocol, and she had raved about it, said she had tremendous benefit from it. She had fibromyalgia. I had outstanding results with the Beck protocol. The first thing I tried was the colloidal silver, and up until the time I tried the colloidal silver, I was having to go to bed about 8 o'clock every night, and I took a full glass of it, and I was up until 1 o'clock in the morning on that particular night. And keep in mind, I had been going to bed at 8 o'clock for the last year and a half, and so when this occurred, it was just totally remarkable. I also noticed in doing the colloidal silver that my immune system immediately started to improve. Now that I recall, also my hair started to come back in. During this whole process, my hair started to thin, and to the point of embarrassment. And taking the colloidal silver, I noticed, in fact, it was amazing because there were various periods throughout this whole last 3 years that I would go off the colloidal silver and go on, and every time I would go on, I see these little sprouts of hair, and it was visually obvious come in. So that amazed me. But the energy level went up with the colloidal silver, and the immune system seemed to gain much more strength. I was no longer catching everything that my kids brought home from school. My energy level was better than it had ever been that I could remember in my life. Now that's an unusual statement when you figure that I'm almost 40 years old. I was back to normal in about 4 months, and had been fine for the next year and a half. My health was fully restored. I started to notice the symptoms coming back, the pain in my neck, the fatigue, and at this juncture I had gained enough knowledge about health and about all the various aspects of causes and treatment that I knew that the reason I was getting sick was my body was trying to tell me there's something wrong, and I needed to figure out what that was. Then I also went back to the diet issue and have since learned that I am hypoglycemic. So I changed my diet. I eat only protein, meats, and vegetables, and water. And that's pretty much my diet. It's very, very strict, but my health has totally returned. And I also still do the portfolio effect. I have a place in that picture for the Beck protocol. I think I can only benefit from it.
The early stages of HIV, I had no idea when I was tested that there was any treatment, naturally, nutritionally, any other type but other than medication. My symptoms, which at the time I had boils on the size of my body about the size of a quarter, and I also had night sweats, which meaning I don't know if anybody knows about what night sweats, but you're asleep in the middle of the night and you wake up in a cold, drenched, wrenching, wet body, and you can't get warm, you're freezing, you consistently try to get dry, and by the time you fall back asleep you're having another night sweat. And I knew I had to do something because I worked for a law enforcement division which looked at me as a public eye, and I obviously didn't look like the kind of person that should be walking in a uniform at 127 pounds. So I finally said to myself, I've got to do something. I started it, I went off all medications, I went cold turkey. It was a very tough decision, but it was either that or nothing at all, because I obviously wasn't progressing and getting healthier. I discarded all medication, started on a 2-week regimen with a blend of multiple herbs, and drank lots of juices, and basically eliminated a few things from my diet that I shouldn't have been taking at the time. As soon as I went off all medications and started the herbal nutrition program, those symptoms resided, and I was grateful, and I thank God every day for it. I looked at every corner that I could possibly look at, and I could never find anything that I could say that could pretty much work effectively if you gave it 100%. And when I found the silver pulsar, which was recommended to me by a Chinese acupuncturist and out of Indianapolis, I realized right then, I said, you know, she's an AIDS specialist. She specialized in HIV/AIDS for over 10 years, and she dedicates her life to it. And she tells me, Dan, you really should try this. And I said, well, you know, what have I got to lose? But I can tell you, if it were me and I had it to do over again, you can darn well bet the first thing that I would be doing, I'd get on the silver pulsar, I'd eliminate this virus like it should be done in the first place, get it out of the system. I did use the magnetic pulsar, and obviously that does need to be utilized as well. And I attribute the magnetic pulsar probably mostly to my hepatitis, inactive hepatitis, because in other words I had to get down to the organs, and the magnetic pulsar is what does that. But I attribute most of this success, and I contribute also the inactive HIV due to the use of the colloidal silver and the silver pulsar. Yes, indeed, it does work. I'm healthy and I feel good, and I do a lot of hiking outdoors. And I'll tell you what, I can pass a lot of my buddies up and down these hills like they have never known. I can be at the top of a mountain, and this is the hunting season right now, and I like to hunt. And so I can walk up to the top of a mountain, I can look down, and they're still breathing hard, and I'm not even panting a breath. That shows immune system strength, that shows durability and endurance. And yes, being healthy is a large part of knocking any type of virus out. And I'll be drinking colloidal silver till I'm 80, I hope. And I'll also be doing the pulsar for maintenance the rest of my life. I can guarantee it.
Okay, so we're looking at a sample of blood that has been analyzed based on live blood analysis. By looking at the sample, we can tell a lot about a person's health or their level of wellness. What we're seeing in this sample is a poorly regulated, or shall we say dysregulated sample of blood, or put it simply, a very unhealthy individual. The way we recognize the status of the person's health in this blood is by observing the blood cells. And some of the things that we observe in this particular sample are red blood cells that have a very spiky appearance. We also see the blood cells tending to clump and stick together. We're also seeing blood cells here which have a very uneven membrane. This particular part of the sample reveals a very large object, quite a bit bigger than the red blood cells. It's not a white blood cell, it's actually what's referred to as a protoplasm, and again reveals that this person's health is very poor, requiring some intervention of some kind. Here we see white blood cells. In this part of the sample we see something referred to as folate formations, another indicator of a very